I would describe Eddie as, he's just a really good kid. He's been through a lot. He always has a smile on his face.
I've worked with Eddie for many years, and I've seen him since he was little and not walking to now he's manager of the football team and running. He's been one of our hardest workers.
What I do, and my colleagues do in pediatric orthopedics, is we monitor how children are growing, and if they're growing well, great. But if things aren't going well, and for some reason their bones and joints and tendons aren't growing well, then that's when we might need to intervene with the surgery to help restore growth back towards a more normal alignment.
Treatments after Eddie's surgery that he has gone through, he's gone through extensive therapy treatments, both with the physical therapist and having multiple orthotics prepared for him.
When we treat children with cerebral palsy, we try to analyze, what the issues are. The Center for Gait and Motion Analysis is a place that uses highly technical equipment to evaluate movement abnormalities. You could imagine that you have two children who look like they're walking the same way, but they could be walking in a similar way for different reasons. And just by looking at them, you wouldn't be able to tell that. But the equipment that we have in the Gait lab can tell us that they're moving, again, in a similar way, but for different reasons. The information then helps guide us towards either non-surgical treatment or surgical treatment. With cerebral palsy, spasticity is one big issue, weakness is another big issue, bone and joint deformity is yet another issue. Even if they've had a rhizotomy and their spasticity is diminished, they still can have a problem with their bone and joint alignment, and we want their muscles to help them to the best capacity that they can, so correcting their bone and joint deformity will help them with that. A single event multi-level surgery is just that. It's a single event going to the operating room for multiple procedures on the legs to improve walking. Then the child goes through one rehabilitation as well, and because they've gotten many of these things taken care of with the one time, they won't be back there the next year and 2 and 3 years later.
Without Gillette, Abby would absolutely not be walking as well as she is today.
Dr. Novacheck told us at our first visit that there would be multiple surgeries for Abigail to improve her walking. And through her multiple surgeries, we have definitely seen that. So the hardship, has it paid off? Absolutely.
There's at least 2 reasons as an orthopedic surgeon that I think it's better for children if the spasticity is reduced before we do orthopedic surgery. One is that if the spasticity is still there, whatever surgery I do has the potential to recur because of further growth. As growth continues, the tendons can become tight again, or the bone can twist again, or the foot can go into a poor alignment. The other reason that tone reduction before orthopedic surgery is good is because the level of spasticity and pain after the surgery that I do is much less. And that's not only good for the comfort of the patient, but it also means that I have a much better likelihood of having a successful outcome with the intervention that I did, because we can maintain the results as the child's going through their recovery. The frequency of spine problems in cerebral palsy depends upon the severity of the neurological injuries. For children who are unable to walk, who are in a wheelchair, their incidence of having a spinal deformity is as much as 40%. The common issues that we see with the legs in children with cerebral palsy are torsional problems, so twists of the bones, so the femur or thigh bone can be twisted, the tibia or shin bone can be twisted. The other things that can happen is hip dysplasia. So the hip is a ball and socket joint, and if the growth forces aren't right, then the socket may not develop very well, and the hip may slide out of the socket. Arm problems or upper extremity problems in children with cerebral palsy are also a result of the muscle imbalance and spasticity. So if a muscle is spastic, as a child grows, their bone gets longer, but the muscle doesn't keep up with the bone length. And there are orthopedic surgeries to either lengthen tendons or to transfer tendons to help improve the muscle imbalance.
Every person at Gillette has a caring attitude towards families, and that's something that we really come to appreciate.